Right, so welcome to today's bite-sized training. And today we have got Sarah Tomlin, who is one of our amazing nutritional coaches. Well, she's got several hats to her head. I'm not sure if that's how you say it, but Sarah's going to be talking to us today a little bit about changes in our digestive system, I guess, as we get a bit older and get towards midlife. So I'm just going to pass you straight over to Sarah. Thank you, Sarah.
Thanks, Louise. I'm just going to share my screen. If you could let me know if you can see that. Can you see
Yep,
that? Yeah,
yep.
okay. Lovely. Thank you very much. So, yes, as Louise said, I'm Sarah Tomlin and I'm a nutritional therapist and health coach. That's what I officially go by. And I am passionate about helping women and men to enjoy food and to cut out any food noise and break free from any dietary restrictions to enjoy eating again. I think it's a shame that so often people have anxiety or a difficult relationship with food, and it really is there to be celebrated and enjoyed. And I want to help people to get back into that space again. But when I first became a nutritionist, my friends would almost be embarrassed to eat in front of me, especially if it was less than healthy, because they didn't want me to judge them. And if I went around their house, they'd say, "Oh, don't go in my cupboards," as if I would. So I had to reassure them that I wasn't friends with them because of their diet. And also, I would never judge anyone for the decisions they make around food because there's so much emotional attachment to food. Um, we don't eat all the same way. We all have varying relationships to food, and this may be because perhaps we were rewarded with food as a child when we performed well. So we have an association that if we do well, we get cake, or maybe later in life, a glass of wine. Or when we fell over and hurt ourselves, we may have had a well-meaning granny that rushed in and, "Here, have some ice cream. That'll make it all better." And although that seems fairly innocuous, especially at the time, our neural pathways will have built up those signals that telling us that eating cake makes us feel good, it makes us feel safe, loved. Um, and the other thing I had to remind my friends of was that just because I qualified as a nutritionist, and this was back in 2019, I love pizza and a pint as much as the next person, and it's about knowing the balance that's right for you. It's not about me telling you what to eat. It's finding what is good for you and what works. And yeah, as I say, it's all about the balance. So I could give you a long list of things to eat and things to avoid, but that wouldn't get people the results that they desire, whether that's losing 2 stone, being free of digestive bloating, or getting rid of heartburn for good. And that's why my approach incorporates health coaching. So it looks at your whole life and your position within it. So there are obviously so many other things that make up a healthy lifestyle, not just food. And we will look a little bit of at those in at the end. But it's not just what you eat, it's how you're eating. If your digestive system isn't functioning as it should, doesn't matter how much kale, kefir, kimchi you're eating, you just won't feel good. So I offer one-to-one appointments predominantly, which are programs. On my website, it's at the bottom of that page. It's got all my programs and prices on it if you were interested or wanted to pass on. And I offer a free gut confidence call to everyone here today and watching the recording. With no obligation. So if you're just stuck with what you're eating, or you've got symptoms you don't know what to do with, or you've been to the doctor and they can't do anything else, then please feel free to use that opportunity. So, what we'll cover today is why good gut health is so important, what your digestive system should be doing, and when things go wrong, what do we do, and tips for good digestion and getting relief for those troublesome symptoms. And even if you haven't got symptoms, hopefully it'll be helpful to learn a little bit about what's going on inside. And what I've learned in my time in clinic is that when a client presents with significant health challenges of any type, there will almost certainly be an impaired digestive system dysfunction at play. And that's what led me to be passionate and to want to start with the gut in everybody that I see. So how good is your digestion? I'm not going to ask you personally to answer now, but if you suffer with bad breath, burning sensation in your stomach, regularly use indigestion tablets, have to go out with a packet of Rennies in your bag, do you often have an uncomfortable feeling of fullness in your stomach? Finding it difficult to digest fatty foods, diarrhea, constipation, often feel bloated. I often get people saying, "Oh gosh, I feel like I look pregnant at about 2 o'clock in the afternoon." And then they have to unbutton their jeans and they have to choose clothes accordingly to where they're going because they don't know if they're going to have to, let out their jeans or whatever. Do you often feel nauseous? Or lots of wind, either direction, fail to have a bowel movement at least once a day, which might be normal for you, but usually we want to see it at least once a day, or feel worse or excessively sleepy after meals. And most of us suffer with at least one of these from time to time. But if any of these are happening to you on a regular basis, then it's obvious it's a message from the body that something isn't functioning as well as it should. And the good news is that these symptoms can potentially be reduced or completely eradicated with nutrition and lifestyle interventions. And we'll look at how to do this a bit later. So, a healthy digestive system is imperative for your well-being. It plays a fundamental role in numerous processes that go beyond absorbing food and extracting the vital nutrients. It's also involved in the regulation of the immune system. The majority of your immune system sits just underneath underneath your gut cells. Basically, they're only one cell thick, your gut lining, and your immune system is directly under that. So anything that's getting through that gut barrier, if that's the permeable gut barrier, can often come apart, and if things are getting through, then that's going to trigger a response in your immune system, and you'll experience things like intolerances and possibly allergies. Um, Mood health relies on your gut integrity. Detoxification processes and hormonal balance are all dependent on how your gut is working. So, the gut, people often think that it's the stomach, this kind of area, the abdomen, but actually, when we refer to the gut, it's an open system that is extensive from your mouth right down to your anus. So it's a long tube and it struggles to function efficiently or become damaged by all sorts of things. I'm not going to read this list because you can see them for yourselves. Um, but the point is the digestive tract is extensive and it has important tissues and cells all the way through that provide its infrastructure to fulfill on its roles. And these are susceptible to damage if we don't look after them. I'm not saying you have to, not have any of these things, but it's looking at what could be causing the damage if you are suffering from symptoms. So, does anyone know where digestion actually begins? Feel free to pop it in the chat. Any ideas on where digestion begins? The process of breaking down your food. Mouth. Very good, Liz. Very good, Louise. Have I gone too far? Moving things around my screen now. I've opened the chat. It's actually in the brain. So the mouth is a very good shout, and that is the kind of obvious place, and digestion does happen in the mouth for sure. But it's when we see, smell, think about food that the brain triggers a cascade of messages to the digestive system that says food is on its way. And this anticipatory process is called the cephalic response. Now, the cephalic response depends on how excited you are about that food. So, if you're thinking about a rice cake, it's probably not going to be as engaged as if you're thinking about a tub of Ben and Jerry's. Not that I'm giving you permission to crack open the Ben and Jerry's, but the dream is long term that you do get excited about a rainbow salad as much as you would get excited about a tub of ice cream. And this is a reality for my clients who say that they completely have changed the way they think about food, and they don't get excited about junk food, but they love the thought and the feeling of having real wholesome food. So, the cephalic response does respond to healthy food thoughts once you change your mindset. Um, but in modern times, food is so available that we can just grab something off the shelf before our body has had time to make that connection that we're about to eat food. Um, so ideally, we've thought about the food and we get a release of digestive enzymes, including salivary amylase, which happens in the mouth. And this is in response to the stimulus that our brain is sending. And we've all experienced our mouths watering, I'm sure. You can certainly see it if you've got, well, a Labrador or a Cocker Spaniel who's dripping water all over the kitchen floor at dinner time. And when we put food in our mouths, you can actually feel if you're chewing something like a bit of white bread or white pasta or white rice, you can actually taste the glucose molecules in it because it's such a simple carbohydrate that you are breaking it down in your mouth and it starts to taste sweet. And that's because the carbohydrate chains are broken down into their simplest form of glucose, and you can actually taste that. And you want to be chewing it so that you can taste it because chewing is a really important part of digestion too. So when we swallow the food, there's a muscle where the esophagus meets the stomach, which is called the lower esophageal sphincter, which should open and close as the food comes down. And it should remain closed after a meal to prevent that backflow of food. And this doesn't always happen. And especially in midlife, this muscle becomes weaker. And so after that, the food enters the stomach. The pressure receptors trigger the production of stomach acid. So both this response to pressure of the stomach distending and the anticipation of food are in response to our engagement of the parasympathetic nervous system. So the rest and digest. On the other side of that, you have your fight or flight, your sympathetic nervous system. And if you are in fight or flight, you won't be able to you make these digestive juices, and you won't be able to digest food as well as you can if you are in that relaxed state. So the food gets mixed with hydrochloric acid, which is produced by the stomach to help with breakdown of proteins, and it also gets mixed with enzymes, bile, and various other elements. And what we know is that this process not only breaks down food, but it also helps us absorb nutrients from our food. And it's all reliant on the step before. So if we don't have enough stomach acid, we don't get enough bile production. If we don't get efficient production of enzymes, and we won't get production of certain things like intrinsic factor that are needed for B12 absorption. So we have to rely on everything happening in sequence to enable us to absorb our nutrients. And so, if we don't get B12, we can experience extreme fatigue, muscle weakness, pins and needles, memory loss, confusion. So the consequences are far reaching if your gut isn't working as it should be. So in midlife, along with many of the other joys that it brings, heartburn is endured by 40% of perimenopausal women and 50% of menopausal women. So it's something that is prevalent and worth knowing about. And symptoms can vary, but it's usually a burning sensation, pain, bitter taste in the mouth. It can even feel like a heart attack, especially if it's coupled with anxiety, and it's really, really unpleasant and can be quite worrying for people if they haven't experienced it earlier on in their lives, in particular. So, what's the reason for this? Well, doctors would have us believe it's because of an overproduction of stomach acid, and the treatment for that is usually a PPI, a proton pump inhibitor. And these prevent production of hydrogen ions by the cell by permanently damaging it. So I won't go into massive detail as you'll probably fall asleep, but essentially the drug locks onto the cell receptor in the stomach, blocking the release of hydrogen ions into the stomach so acid can't be made. But the body continues to make these acid producing cells and continues to release signals telling these cells to release hydrogen ions to make acid. So it doesn't get the message that the cells are being blocked. And over time, we get too many chemical messengers. And what happens for a lot of people is that once they stop taking the PPI, because you shouldn't be on it for very long, this should only be like a couple of months max, which is the recommendation by NICE, the clinical excellence people. But when they stop taking it, even if they've taken it for a short time, these cells, which are still being made, are no longer blocked by the drug. So all these chemical messengers now have lots of cells to hook onto and enable acid to come into the stomach. So because of the vast number of signals which have been held back like a dam, there's now 3 to 5 times more acid than you need being released. And so obviously you are going to feel those experiences, those symptoms of heartburn and that experience of having acid coming up through your lower esophageal sphincter up into your esophagus. But as a result, people think that, oh, the PPI must have been working really well because look what happens when I take it away. And they don't understand that it's a rebound effect. And it's not explained widely by the medical profession either. And so people tend to go back on the PPI and then you're getting people coming off and then going back on and just a cycle that they're not happy with because they want to come off the drug, but they feel like they desperately need it. So helping them understand the reason why they're feeling how they're feeling is important to me. And the stomach acid insufficiency, the symptoms are very similar to overproduction of acid, but the blanket approach is just to give this PPI. So you could have not enough stomach acid, which is why you're experiencing these symptoms. You know, you're not breaking down your protein, so you're feeling full, you're feeling nauseous, you're getting that feeling in your throat. And so whether you're naturally low in stomach acid, which happens as you get older, especially in perimenopause, and uh, actually on into old age, your stomach acid becomes lower and lower. And that's why a lot of elderly people avoid protein, so they don't have meat and things because they feel that they can't digest it because they don't have enough acid. But if you have got low stomach acid naturally as you're aging, or if you're because of the PPI you're taking, then you have reduced digestive capacity and you're not absorbing the nutrients and you're not killing certain bacteria that the acid also takes on. And you can just generally start to feel unwell. Um, but a lot of the time, it's not to do with the overproduction of acid or the underproduction of acid. It's where the acid is, and also the inability of that lower esophageal sphincter to hold those stomach contents in and stay closed. And that's largely the problem in a lot of cases.
Sarah, Liz posted a thing in the chat about omzipol.
All right, omeprazole.
Mm,
Your doctor tells you to take it daily. Was it omeprazole, Liz?
Yeah, it's omeprazole. Yeah, sorry,
ah,
Yeah.
my bad spelling.
No, no, that's
Um,
okay.
but yeah, I take it daily, and I have been watching like good old TikTok who like says, you shouldn't be taking this daily. And when I've spoken to him, he's like, well, it's it's better kind of to take it than to have like the symptoms that you suffer from.
Hmm.
So it's like because I've thought that taking it daily is a lot, but the day that I don't take it, the pain is really, really bad.
Yes.
Um,
Yeah.
and that, yeah, there's something always kind of, you excuse the pun, like in my gut. I'm like, I don't think taking this daily is right.
Mm, okay, that's interesting. Because some people should, I mean, it is a drug that works and it is effective, and some people should definitely take it. So people with Barrett's esophagitis, or people with who are taking ibuprofen or the other non-steroidal anti-inflammatory drugs that are damaging to the to the gut lining. So there is certainly a place for it. And if you are prescribed it, then taking it every day is the usual thing to do. But some people are on it for years and years unnecessarily, but it's just that they don't know how to get off it or what to do to sort of heal their gut. and address the root causes without it. So it's not necessarily a bad thing that taking it every day. It's just, that's a personal thing to you, whether if you're feeling like you shouldn't be taking it or that you're not comfortable doing it, then it's certainly something to look into. But it should only be taken at the lowest dose for the shortest amount of time.
Okay, thank you.
Yeah, but yeah, we can chat about that, or we can have one of the 40-minute calls if you want to talk about it more.
Yeah, thank you.
Thank you. Um, okay, so the reason we experience these things in midlife is because, or sort of perimenopause, menopause, is because our enteric nervous system is sensitive to estrogen, and when estrogen levels drop, it works less well, and so the production of saliva, stomach acid, bile, and enzymes is impaired. And high stomach acid triggers a strong sphincter closure. So when the acidity decreases naturally with age and a drop in estrogen, the low stomach acid causes the relaxation of this muscle and food is brought back into the esophagus. So that's the reason. Another common thing, and this is the last sort of condition I'll be talking about before we get on to what we can do. Um, Another common thing in our 40s is bile acid reflux, and people don't necessarily know about this, and it can be confused with just reflux of the stomach acid. And so, if a PPI is prescribed, it might not be doing anything, or it might actually make it worse if it's actually bile acid that's being experienced. And this is closely associated with silent reflux. So the reflux you might experience at night, maybe without knowing about it, or the symptoms seem to be a lot worse in terms of pain and nausea. So it's worth looking into whether this is actually the root cause. Bile is made by the liver and stored in the gallbladder and released as part of the digestive process to break down fats and absorb fats. It's antimicrobial as well, so it keeps the digestive tract bacteria under control, and so obviously it is essential. And you do produce bile without a gallbladder. The gallbladder just stores it. So if you haven't got a gallbladder, so the bile is produced in the liver and stored in the gallbladder, and the gallbladder sort of releases it in spurts when you eat. If you haven't got a gallbladder, the liver still produces it, but it sort of drip fed into the stomach, into the digestive system rather than spurting. So if you've had your gallbladder removed, you might have to be careful about the fats that you eat. You can still eat healthy fats, but just perhaps be careful of the amount. But what we see in midlife, particularly with bile, is that it becomes sludgy. So it basically, if it doesn't flow well because of other things that are going on, then it can stay in the gallbladder or in the ducts, calcify and become hard. And it can, so you can either have biliary sludge where it becomes very thick, or gallstones if it becomes worse. And gallbladder problems become more frequent post 40, and it's more common in females, as you might expect, due to that drop in estrogen and progesterone. And it's common in estrogen dominant conditions like endometriosis, or if you have heavy periods or menstrual cycle issues as well. Common in diabetes, or those with higher sugar intakes, and also can occur with rapid weight loss, and also those with sedentary lifestyles. If you have an underactive thyroid, again, that's common in midlife. Bile acid reflux can be more common. And also, alongside all this, your cholesterol is increasing naturally in your 40s. And biliary sludge is a combination of high cholesterol and bile. So those two mix together, making the flow very slow. And the more sludge you have, the less cholesterol clears in your liver, and it becomes a self-perpetuating issue. So it's important, and there are things that we can do to help with that sludge. But because of the backup of cholesterol, if you don't clear it, it will just get worse. So if you have antibiotics or other medications that can cause biliary sludge, GLP-1, metformin for diabetes, then coming off this medication, which obviously isn't possible for some medications, but things like antibiotics or even GLP-1s, it can improve that sludge. But if you have things like underactive thyroid, menopause, or medications you have to take over a long period, then you'll need to address this sludge sort of longer term and perhaps take things for it going forward. It can also cause delayed gastric emptying, and so your stomach feels fuller for longer. You might feel very full up after eating, and it can also, this fullness can weaken the lower esophageal sphincter, which opens up to allow food into the esophagus, as mentioned before. And if you've got a hiatus hernia as well, this sphincter doesn't work very well anyway. So getting the bile moving is important. The lower esophageal sphincter is relaxed by certain foods as well. So cutting some of those foods out temporarily while we work on your digestive system as a whole is important. And these are things like chocolate, alcohol, caffeine, peppermint, spicy food, and tomatoes. Now, you might not react to all of these, but some people might find that one is a particular trigger. And I think with peppermint, sometimes people don't realize because it is used as a digestive aid in some things, and even something like a peppermint tea at night, which might seem quite innocuous, can actually exacerbate your silent reflux. So other things you can do if you are suffering from this, aside from dietary changes, Gaviscon can be your best friend if you've got reflux, because it actually forms an alginate raft in your stomach, and so it sort of sits atop of the stomach contents and blocks the entrance to your esophagus, so nothing can get up there. And it's quite okay to use Gaviscon before bed. And sometimes people, if they have symptoms during the day after meals, will take it after meals to prevent that kind of backflow. And that's okay to use. And if you were to come off your PPI, then that is certainly something you should be using, because we don't want damage to the esophagus. And that's something we just definitely don't want, because that can lead to other things further down the line. You can also elevate the head of your bed using a wedge pillow, so gravity's working with you. Not eating 3 hours before bed allows food to move through your digestive system. And also sleeping on your left-hand side can be helpful, because the stomach drops into the gap, making it harder for the contents to move back up. So you are using gravity in that way. So unfortunately, my favourite side is the right-hand side. And I consciously turn over to the left, but it doesn't last very long. But if you don't have symptoms, it shouldn't make any difference anyway. So I mentioned the nervous system earlier on, the enteric nervous system, which is part of the parasympathetic nervous system that controls our digestive system. And we have no control over this. No conscious control, it just happens. The body knows what it needs to do and it does it without us thinking, right, I've now got to release some bile to break down some fats. And as I mentioned, this cannot happen if we're in fight or flight. Fight or flight, you're in fight or flight, or you're in rest and digest. So that means when we're stressed, we are not able to digest our food because your body's preparing to run away. And it's just a really good thing to bear in mind, because if we're rushing to eat our lunch before our next meeting, or grabbing something on the go, we're just not going to get those nutrients from the food that we're eating. And if we've gone to the trouble of, buying good ingredients, making the food, and we're just shoveling it in, then we're just not going to get the goodness from it. And your digestive system is going to be compromised without a shadow of a doubt if you're eating when stressed. So until we manage the stress, you're not going to move forward with symptoms, no matter how many supplements or organic vegetables you eat. And so, as I mentioned, digestion starts in the brain. It's that anticipation, the thought, the smell, the sight of food. And it's 20% of our stomach acid that's produced in response to that trigger in the brain. So if you eat your food you can have your food in your hand in minutes, if not seconds these days, if you're passing a shop, and that's eliminating 20% of the digestive process. So It takes 20 minutes from the brain trigger to the food coming in to get those juices and everything ready. So if you're not preparing the food and not thinking about it, you're losing 20 minutes worth of prep from the body, getting ready to receive the food. So other things to do, and obviously sometimes you have to grab something on the go, and it's very difficult to find healthy food out and about these days. But if you can, sort of organize your day so that you are able to sit with the food, ideally in a good posture, sitting at a table, not crouched on the sofa or slumped over your desk, because then you're using gravity and you're using, opening the tubes so that the flow of food and the transit is much smoother. Chewing your food is so important. We all know this, we were told it as children, chew your food. And for good reason. It increases the surface area so the chemical substances can get to all of the food, and it also primes your stomach to receive the food. You should be chewing soups and smoothies even though you don't need to chew them to swallow them. But that, as I say, that sort of mastication will get the other digestive things going as well. And if you had to spit out a mouthful of food, no one should be able to know what has been in it. So it should be like a mush, a liquid. And I've had clients that just doing that, just sitting and chewing their food, and they fully admit that they inhale their food, know that they should be chewing it, but not really understanding the impact of not chewing it. And that's the one thing that they've changed and worked on. And a lot of their symptoms, reflux symptoms, have disappeared just from chewing their food. So it's really cannot be underestimated. Putting knife and fork down between mouthfuls helps because it takes longer. And also you feel fuller if it takes longer to eat your meal. If you have the benefit of time, take your time over your meal and you will feel fuller, which means you're less likely to want something sweet after it. So the bigger picture, sleep, circadian rhythm, consistent bedtimes, morning light exposure, reducing screen times in the evening. This all helps with your stress response. So getting your parasympathetic nervous system engaged when you need to, when you're eating. And good sleep will benefit your digestive system and vice versa. If you're hydrating, you're more likely to be able to make stomach acid because that's largely made from water. Your electrolyte balance will be good because you're, absorbing things further down the digestive system. And if you're consistent with your hydration, it's important too. You don't want to be drinking 2 litres in the morning to get it done. And out of the way. I did know a lecturer actually at college, when I was studying, she had somebody, an ex-student that, their client took 2 litres of water in the morning, and unfortunately they died because all of their electrolytes were completely removed. And yeah, it wasn't great. So sipping water throughout the day is very important. And so I always tell my clients this now, just in case, because some of them don't like drinking water and they just want to get that job done and ticked off, but it must be consistently regular throughout the day. Movement, it's good to go for a walk or do some sort of light movement after a meal because it helps to balance your blood sugar. And balancing blood sugar is the foundation of, all health, I believe, in terms of, nutrition anyway. The energy that you're taking in, if it's not stored, it needs to be used. And so walking can help with that. And obviously it can help with the motility of your digestive system as well. So just keeping active, and the motion of walking helps with the digestive transit. Routine is, great. Regular meal times, the body knows when to expect food. The body loves rhythms, so it has various rhythms all throughout the body, not just the circadian, but the liver's has got its own rhythm. And there's something called the migratory motor complex, which is a series of mild contractions that move all the leftover digestive elements, bacteria, that's not needed at that time, to be cleared through the body. And this happens, the body needs sort of 4 hours for this to happen. So if you ingest food, that will stay digesting for about 2 hours. And then once that's cleared, the migrating motor complex, which is I like to think of as like a street sweeper, goes in and out of the grooves of your digestive tract and gets rid of all those digestive debris and bacteria that's not needed, and just clears it out. But if you're not allowing that to happen, so say you had lunch at 12 and then you had something else to eat at 2 and then you snacked again at 4, you're not giving your body that chance to clear out all the debris. And so things can build up over time and you can get food starting to ferment in the little folds, or things like diverticulitis, or problems with your appendix where things are just getting blocked and not cleared out. So um, it's really important to make sure that's engaged, and it happens overnight because we're naturally fasting. So, but it's good to have that happen during the day as well. And then minimizing external stress. Obviously, there's stress that can't be helped. But what we can do is manage the stress when we're eating. So, some things, house move, divorce, news, those sorts of things are going to happen, and we dealing with those things is kind of a separate issue and worth looking into. But if you can just separate yourself from that whilst you're eating, that's a good start, because you know you'll be in your fight or flight response if you're reading about the latest Trump saga or whatever while you're trying to eat your lunch. So yeah, staying away from news, scrolling, anything that's going to distract you from eating, is a good idea. And although you may not feel psychologically stressed, the load of your lifestyle, so your to-do list, whatever's going on elsewhere, your allostatic load, is enough for your body to react in a stressful way. So getting into that rest and digest is really important. So, what to do next? If you do have symptoms, or you're struggling with your gut, or you don't know what to eat, or there's some foods that you're intolerant to and you don't know why, you don't know if you need tests, you don't know if you need supplements, then please feel free to reach out to me. And as I said, I have a 40-minute complimentary call to anyone wanting to get help in this area, with no obligation to work together, but just a chance for you to get some clarification or to get some insight or guidance in the short term. More than happy to speak to anyone who's interested. So that's the end of the presentation. I don't know if anyone has any questions, but feel free to ask.
Thank you so much, Sarah. Let me just stop the recording and then we can ask some questions.